Assalamu alaikum. I am Dr. Tanzim Rafat, lecturer, Department of Anatomy. Today we will discuss briefly about the anatomy of bones. At first, we will know the definition of the bones, their function, their classification, and then others. Now, what is bone? Bone is highly vascular and mineralized tissue. It is highly vascular. And bone is also called special connective tissue. Composed of some cells and tissues and form the structural framework of body. So in a nutshell, bone is highly vascular, mineralized, specialized connective tissue which is composed of cells and some extracellular matrix and form the structural framework of body is called bone. Now, what is the basic function of bones? It provides the framework of human body. Bones also act as lever for muscle. That means a muscle which is attached to the bone helps in different movements in human body. And we know that bone contains a marrow cavity which contains the bone marrow, and bone marrow is the storehouse of hematopoietic cells. Bone consists of some organic and inorganic substances such as calcium, phosphate, and so by this way bone is also act as a storehouse of calcium. And bone ultimately protect our human body. That means it protects the human viscera like heart, lungs, etc. Now, what will be the classification of bone? We can classify bone in different ways according to position. Some bones are axial and some are appendicular bone. Axial bones. Vertebra, skull. Appendicular bones. The bones of pelvic girdle and pectoral girdle. According to their ossification. Membranous and cartilaginous. And out of them, most important classification is the classification according to shape of bone. Now we will discuss the classification of bone according to their shape. Long bones, short bone, flat bone, irregular bone, pneumatic bone, and sesamoid bone. What are the criteria of a typical long bone? These bones are usually weight bearing. They lie vertically in human body and contain the medullary cavity. So these are the important criteria of typical long bone. That means they are weight bearing, lie vertically in our body and contain medullary cavity. Now we will discuss about the parts of a long bone. Epiphyseal end. Epiphyseal cartilage. Metaphysis and diaphysis. Now we will discuss about the epiphysis in short. Epiphysis means the part of long bone that ossify from the secondary ossification center. Before going to it, we will discuss about the ossification center. Normally, there are two types of ossification center present in human body. One is primary ossification center and another is secondary ossification center. The ossification center denotes that area of the bone from which the bones are developed or ossification is completed is called ossification center. Regarding primary ossification centers, these ossification centers usually appears before the birth. That means in utero it develops and ossification completed after birth. This is epiphyseal end. And now we will discuss about the epiphyseal center. Ossification center. It is two types, primary ossification center and secondary ossification center. Primary ossification center. This ossification center in bone usually appears before the birth. Some are exception in this case. Carpal and tarsal bone. Normally primary ossification center appears before birth and primary ossification center have the special function. That means the main part of the bone is formed from the primary ossification center. But in case of carpal and tarsal bones, these bones ossification from the portion the bones is ossified, they are appears after the birth. But normally primary ossification center usually appears before birth. And now secondary ossification center. Secondary ossification centers are those ossification centers that are form the accessory part of the bone and appears after the birth. Now epiphysis. Epiphysis is the part of the bone that is ossified from the secondary ossification center. Now diaphysis. Diaphysis is the part of the bone, long bone, which is ossified from the primary ossification center and mainly form the shaft of a long bone. And metaphysis. The portion of diaphysis facing toward the epiphyseal cartilage is called metaphysis. And in between epiphysis and metaphysis, intervening epiphyseal cartilage. Now we will discuss about the epiphysis. There are three types of epiphysis. One is pressure epiphysis, traction epiphysis, and aberrant epiphysis. Pressure epiphysis usually formed in the pressure bearing or weight bearing area, like the head of the femur. This area is pressure epiphysis. Now traction epiphysis. Traction epiphysis is the epiphysis which is formed due to the traction of the muscle during movement or during contraction of the muscle. And the classic example of the traction epiphysis is greater and lesser trochanter of the femur. So this is our today's discussion, and inshallah we will discuss with another topic in next class. Thank you. Assalamu alaikum.